welcome to the very first Muslim Institute webinar. So moving our activities online is a bit of an experiment, so please bear with us. Hopefully technology will be on our side today. So thank you for being here, and I hope you're all safe and well. I think it goes without saying that we find ourselves in a situation so unprecedented and volatile and uncertain that it seems almost unimaginable to attempt to make predictions or present solutions. But I think what we want to do here today, with the help of our three speakers, I have Dr. Irum Ali, Dr. Rubina Jasani, and Naima Khan here today, is offer insights based on their experiences and look at how we can build communities and access resources and redress inequalities in order to shape a more resilient post-virus world. Viewers can also take part, so if you wish to put any questions to our panel, please type them into the comment box and we'll do our best to answer them in the Q&A. So I'll start with Irum. Irum, based on your experiences of researching BAME communities, how would you respond to the title of this webinar?
I think what I'm going to do now is just to kind of lay out a little bit of groundwork about how the COVID-19 crisis is impacting BAME communities. And I think later on, we're going to talk in much more detail about why it might be that specifically BAME populations have been, more affected, disproportionately affected compared to white British populations. So I'm just going to throw out a few statistics, and if I look down, it's because I'm just looking at some notes because I don't want to get them wrong. So minority groups are overrepresented by as much as 27% in the overall COVID-19 death toll. A third of COVID-19 patients in ICUs across England and Wales are BAME. 63% of the health and social care workers who've passed away that we know of COVID-19 are BAME. And just for perspective, 20% of all NHS staff are BAME and 44% of NHS staff, medical staff, are BAME. So that's a disproportionately high amount even within medical services. We, the Institute of Fiscal Studies has just released research in the last few days saying that if you live in the most deprived areas of England and Wales, you're twice likely to die from COVID-19. And we know that BAME populations are concentrated often in those areas. If we take London, for example, the boroughs of Hackney, Newham, and Brent have been the most affected, and all these three boroughs have high BAME populations and Muslim populations in the case of Newham. The death rate amongst, for example, British Pakistanis are twice as high than in the white population. And to kind of bring this all together, we know that ethnic minority populations skew young in this country rather than elderly. So there's a question here. Why is COVID-19 disproportionately leading to more deaths within ethnic minority communities? I'm going to kind of, unpack this a little more later, but it's a set of complex explanations. And the way we can think about it is that BAME populations suffer under a triple bind. So first of all, we've got economic deprivation that lead to exposure to the virus. For example, BAME populations are more likely to be key workers who are unable to work from home. They're more likely to work in NHS, so they are on the front line. They're more likely to live in overcrowded housing, live in conditions of poverty and so on. The second thing can be that there are pre-existing health inequalities within minority ethnic communities that lead to kind of having comorbidities that mean that they're more likely to have a severe bout of coronavirus. And lastly, and this is kind of a bit more nebulous, there's discrimination, both institutional and individual level discrimination that impacts BAME communities in general, but also specifically related to this virus that have kind of been exacerbated in the current situation. So hopefully that's a tiny bit of an overview, and we can kind of unpack what that means for now and the future as we go on.
Okay, that was great. Thanks, Irum. What are your initial responses to the title of this webinar?
So thank you, Saima. I am going to tackle this question from the perspective of gender. And I want to make three main points in response to the title of this webinar. The first point I want to make in relation to the government's, statement that stay home, stay safe, and how that idea has actually compromised the safety of thousands of women across the globe. So we have evidence that's emerging from China, Brazil, India, France, Italy, UK, which is consistently telling us that the rates of domestic violence have gone up. Yeah. Secondly, not only have the rates gone up in UK, we've seen like them rising by a third. We also have seen a rise in phone calls that refugees have by 50%. There have been 14 deaths of women that have been reported in the UK within home settings, and most of these deaths are by most of them have been killed by their family members, and 2 children have died as well. And I think though domestic violence affects all communities, I think there is something to be said about the ways in which ethnic minorities actually experience domestic violence, and also who has access to resources. And I think this is particularly important because the parliament has just had a second reading of the domestic violence bill, where again the rights of migrants have not been addressed in the same way that they should be addressed. So even despite the fact that Priti Patel has unpacked this massive package for survivors of domestic violence, women who are wives of migrants and are dependent on their husbands for visas are disproportionately represented in the numbers that we are seeing right now. I work with a charity in Manchester called Safety for Sister as a volunteer, and I'm on the directorial board. And one of the things that we have noticed is the fear of reporting, the fact that they feel that their cases are going to be looked upon as immigration cases and not cases of domestic violence. So women continue to suffer at home. And and then I think what we need to think about in the post-COVID world is how are we actually going to provide, when these numbers come out or when people are able to speak about this, how does the civil society work for the safety of these women? That is the first point I wanted to make. But I also think that, and for that, I think what Safety for Sisters has done, and I've been, we've written a position paper, which we are now using to liaise with the city council, to get the mayor on board, to get our MPs on board, and to escalate, this movement from the perspective of women who have no recourse to public fund. And I think the demands are very clear. Not only do we want, these women to have the security of not being deported, so not being looked upon only as a product of the hostile environment, but to be looked upon as, to be looked upon as cases of legitimate domestic violence. And the second demand is that we, everybody should have, recourse to public fund, including refugee women. And I think this is something that is particular because there is a lot of fear in relation to coronavirus, where, in the last week, Safety for Sister has been struggling to get 3 women, because there is not adequate knowledge even on the front line of whether women who have no recourse to public fund have access to health. So I think this is a real issue that one needs to think about. So I think that's one thing that I wanted to highlight, the issue of domestic violence and how in the post-COVID world, when these numbers, and I think one of the things that we are thinking is that the numbers are grossly underrepresented, and we are going to see an escalation of cases coming out of COVID. So how do we prepare for that? The second point I wanted to make, and this is, I think, very important, is that this is not just a public health issue, right? This is also an economic crisis. And this should not mean that, and I think the gendered impact on work is something that one really needs to think about in current times. And I think, and if we look at the evidence that emerged out of, in the post-Zika, Ebola, SARS world, what was very evident is that the working lives of both men and women were affected after what they went through. but women lost more work in the long term. And I think this is something that I want to emphasize very strongly about, is that women's independence cannot be the other victim of the kind of world we are existing in. Also, I think, so then how do we, your thing is, respond to the question. So what happens in the post-COVID world? And I think we are going to need stronger unions than we've had, because, just before, I work at the university, just before we went into the lockdown, 733 universities across the UK were demanding, were protesting, were on strike, or against the gender pay gap, against 0-hour contracts, or against the BME pay gap. So, and I think I just feel in this lockdown period we've kind of clamped down on, I feel like whatever we gained, whatever negotiations were happening, I feel like we are going to have to retract some of those gains, because we are constantly being told, thank yourself, you have a job, right?
Yeah.
So I think that's also one of the casualty that one needs to think about. And I think linked into all of this is my last point, I promise, Samia, is the whole idea of the increasing informalization of work. Yeah, especially related to the service industry that is taking place right now. Where we are seeing, who are the people who are stacking your supermarket, your supermarket aisles, who are the people who are doing your deliveries. And I think there is something to be said, and this is linked, there is something to be said about holding the big corporations accountable, because we are seeing a further informalization of economy. And again, like Irum was pointing out, the informalization of economy only means that the impact on there's a strong gender and BME impact that is going to happen. And hence, how do we get the care workers, the people who are part of a lot of casual contracts, how do we get the big corporations accountable, is something that I want to end on. There's something else I wanted to say, but I'm sure I can say it in the question answer session. Thanks.
Thank you so much, Rubina. Now, Naima, can I ask you to come in and talk a little bit about your take on visions for a post-pandemic future? What you envisage are the challenges and the hopes for the future. Naima, can you hear me? I don't know if Naima can. I just want to bring you in here. Do we have Naima? No. I think we may have lost Naima there. Okay, so in that case, I will. We were always going to have technical issues. I thought it was going to be my internet that would drop off, but it's obviously Naima's. We'll try and get her back.
Okay.
So I think I'll kickstart the Q&A in that case. So I think perhaps I'll ask you, Irum, to talk a little bit more about the way about the way in which BAME communities are disproportionately impacted. You mentioned this. Can you go a little bit deeper into the reasons why that might be?
Yeah. So I think the easiest way to think about it is as I kind of briefly mentioned in if we look along three vectors, which is one is about economic deprivation and what that means for COVID-19 and exposure to COVID-19, which Rubina kind of alluded to, talking about casual hours contracts and frontline jobs. The second is I'm going to go into health, and the third one is talking about institutional and individual racism. So if we look at the first one and we think about economics and how that plays into it, we know that by and large, BME Britons are worse off than their white British counterparts. So they have lower incomes. For example, 46% of Pakistani Britons live in poverty, and 50% of Bangladeshi British live in poverty. and that those are high numbers. They also have less savings than their white British counterparts, and they spend more. So, for example, a larger amount of their monthly incoming goes into rent and food, and especially in a time of crisis, for example, when maybe the main breadwinner of the family might not be working the same number of hours, this becomes really critical because you don't have a cushion with which to buy your essentials or to get by from day to day, and this can have profound impacts on the lives of your family. They are also likelier than other groups to receive working tax credits and benefit top-ups. They often have higher unemployment levels. And as we all know, they face higher discrimination in the labor market. So, for example, there's been loads of research that's shown that even when times are good, it's more difficult to get a job, especially if you've got a Muslim sounding name compared to, John Smith. And in times like this, we know all those things are even worse. There's a pay gap, there's an ethnicity pay gap. So that again factors in. And I think the most important one is that they are much likelier to be in positions where they are exposed to the virus. For example, 25% of TfL staff are BAME, and we know that they're still working. We know that nearly 40 bus drivers have died from COVID-19 because they just weren't protected in the early days of the virus, and they still had to keep working. And so they also, kind of when we look at this framework that they, compared to other groups in the UK, don't have as much in a time of crisis, when work drops off a cliff, when the benefit system is completely overburdened and it might take weeks to get your universal credit through. We know that BME families are going to suffer more, and that has knock-on impacts to health. The other issue, if we look specifically at Muslim communities, is that, for example, they live in much more overcrowded accommodation. Well, they're likely to, and these are statistical generalizations, much more likely to live in overcrowded accommodation and in multi-generational households. And this is a key thing. So, for example, we've been told to stay home, stay safe, to isolate from elderly members of your family. But if you live with elderly members of your family and you live in a large family, and some members of those families have to go out to work, they don't have the choice of working from home. Working from home is a privilege. It means you have a job that can be done remotely and doesn't require your physical presence. And if some members of the family has to go out and work, and they're vulnerable members, elderly members living in the same household, then how do you self-isolate? How do you kind of put that puzzle together? And that means that the whole familial group is now exposed to COVID-19. So that's kind of the economic framework. I'm going to quickly touch on health and discrimination. So there's been a lot of talk about in the media about, why are, for example, South Asian men much more likely to die of COVID-19 than kind of other groups. And so loads of theories have been mooted, and at this point it's all theorizing because we don't know, the data doesn't exist. So a hospital in Birmingham just today announced that they're going to do an in-depth study linking with council level data to see why South Asian members of the South Asian population are far more likely to be in the ICU and far more likely to die of COVID-19. So the things we do know, that there are high rates of hypertension, kidney disease, heart disease, and diabetes in South Asian and Muslim communities. And these are really fatal comorbidities for COVID-19. And I don't want people to take away from that, oh, South Asians or Muslims are unhealthy. It's not just that. You're much more likely to have these comorbidities if you're poorer, if you don't live in a big house, if you don't have space, if you don't aren't able to exercise or have a garden or all those things. So I think it's very easy to look at health conditions that exist in certain populations and blame it on those populations and say, oh, well, what's wrong with you? And I think that's not the right tack to take. Poverty really increases your susceptibility to certain types of diseases. So I think that's something to really think about, is that the level of comorbidity. And the last one, and I think probably the most difficult one to put a finger on, is about discrimination. And this really pertains to BME staff working in key worker roles, in frontline medical roles, and in the NHS. So there's loads of anecdotal data. I've had friends tell me that they are more likely to be put on hospital duty as compared to their white counterparts who are on the same pay grade. because they feel like if they are put on hospital duty, they can't complain and they can't raise their voices in the same way as, you know, as their white counterparts, because they already feel maybe, quote, lucky to be in senior positions in the NHS. And kind of these are things that are really difficult to kind of put your finger on and to say, well, this is racist behavior. But it could be that there are these kind of really subliminal forces of racism working at the institutional level. And because there are so many BME staff in the NHS, they're much more likely to be exposed to the disease. And if these BME staff come from families where they are poorer than their white counterparts, as a general rule, they're much less able to say, hey, I'm going to self-isolate, or I don't feel comfortable working, because they have to work. So I think it's a kind of a complex set of circumstances coming together to create this spike. But again, I must really stress that these are all theories as of now, and so much more research is necessary to kind of really tease out the reasons.
Thanks, Irum. I'll bring Rubina back in just while we're trying to get Naima back. I think she has a connection issue. Rubina, I'll just pick up on something that you mentioned earlier, which was the way in which society values labour and the gendered aspect of this in light of the pandemic. And I know that you wanted to make another point on that. So please do go ahead and elaborate.
Yeah, so the point that I was trying to make, and this is not the point I wanted to make, there was another point I was trying to make. I think in relation to the gendered nature of labor, the thing that I want to say is, this whole neoliberal idea of productivity, right? Which has been sold to us, whether you work at the university or you work for a policy institute, you're constantly, this idea of productivity is constantly hemmed at you. And I think it is really important to, think about working mothers right now, where the distinction between the home and the working space, which is a very important distinction for a lot of women, has kind of blurred, right? You are putting in far more domestic work. You're putting in far more hours of work to keep bringing the salary that you're bringing in. But at the same time, there is a blurring of boundary between the home space and the domestic space, where you also feel, as a woman, take on the responsibility of keeping everybody happy. I myself, I live by myself, but I feel like I'm doing far more domestic work than I've ever done before. And I think that's because, we are all living we are living in domestic space. And I think there's something that has to be said about this whole neoliberal idea of productivity and the pressure. And I think it's really important to realize that this is not normal. I don't like the word the new normal, because this is a state of exception. And and I think that's something that one really has to think about, when one starts thinking about the gendered nature of labor, is the kind of pressure that you're putting on women and the kind of compromises that you're asking of them when you're trying, in the current pandemic, because it's not easy. And I think I will make the larger point that I wanted to make, which is again tied into the idea of, which is again tied into the idea of labor, which is tied into the idea of migrant labor, right? And the message that the state is constantly giving, which is that some lives are more dispensable than the others. I think Naima is back. I think, this whole idea of how some lives are more dispensable than the others, and where, and the images that come to my mind is, the people in Brazil, the indigenous people in Brazil, the images we are seeing of migrant workers trying to go back home in India. And I think, the death of a 13-year-old who died of hunger trying to walk home is something that continues to haunt me on an everyday basis. And I think therein comes the question of accountability. Is that, why are these lives dispensable, and who is accountable? Who do we ask questions to? That 13-year-old who died, why were things not put in place by the state to make sure that people don't go hungry before the lockdown was introduced? And this is just one of, and so that was the larger point that I wanted to end on. So I think, I'll stop here and then we'll continue the conversation.
Thank you so much, Rubina. Naima, glad to have you back. So I'd like to bring you in now to talk a little bit about your response to the title of the webinar. Is Naima, I think Naima's connection may be on again. So I'll pose a question to Rubina and Irum while we connect back. Can you tell me a little bit of the responses to the pandemic that each of you has seen implemented or has experienced being implemented in the sort of fields of your specialism and that has worked? And if you could explain a little bit about why that's worked. Irum, do you want to sort of take that up?
Yeah, I think lost my train of thought there for a second. So one of the things I really wanted to flag up was some good news, because I think we could all use some good news. There's a kind of a mythologizing of Muslim communities. I live in East London, I live in Bow, I live in Tower Hamlets, which is right next to Newham, which has the highest death rate from COVID-19, one of the highest death rates in the country. I think there can be a kind of a narrative of the Muslim community or South Asian communities being resistant to change, being very kind of static in their acceptance, not really fully being part of the mainstream community, slow to understand things. And one thing I wanted to flag up is that in Tower Hamlets, where I live, the levels of COVID-19 are not nearly as high as expected. And one of the reasons I think this has happened is because Public Health England coordinated with local councillors and local mosque leaders. So they basically talked to the Tower Hamlets Council of Mosques on Wednesday, the 18th of March, which is 5 days before the government imposed lockdown on the 23rd of March. And they had a meeting with them, and the Tower Hamlets Council of Mosques decided to not hold Jummah prayers from that Friday onwards. And if we take into account that there are 50,000 regular attendees of Jummah prayers in the borough of Tower Hamlets every Friday, the potential of infection from that one gathering is huge. And a decision was taken at that meeting in consultation with local doctors, with Public Health England and local councillors to not hold Jummah prayers. Now, this seems like a small thing, but that one meeting, the ripple effects of that were that infection rates in Tower Hamlets, for now at least, and it's been more than 3 weeks since that decision, have remained low. And so for me, this is an example of really boots on the ground public health work. You know, so when we look at, so I'm from Bangladesh, and a lot of our public health successes have not been about top-down strategizing, have been about going into the villages, knocking on doors, talking to communities, talking to men and women, and explaining to them why X or Y initiative or why X or Y approach works for their lives or can improve their health outcomes. And that's exactly what happened here. You know, it wasn't about, you know, a television announcement. It was talking to the community at the level of the community and saying, hey, this is what you can do to help. And I think this is really important to think of in terms of austerity, which has seen the gutting of public health outreach in this country. And that has meant that things like this used to happen all the time. So I work in mental health in the Muslim community, and outreach of mental health is almost nil now because there's just no funding for that. And, you know, the response to this crisis was kind of like an emergency response. And sorry, so I'm gonna basically, so that was my good news response, that I think old-fashioned public health outreach can work in this situation and has worked in this borough. And I think if we think of a government, what governments can do, or what communities can do, it's kind of do what you've always done and get together and talk to each other.
Thank you so much, Irum. Naima, thank you for persevering. If I could bring you in now to sort of give us your initial responses to the title of the webinar. I think we can't.
I don't think we can hear her.
Naima, we can't hear you. Do you have your microphone plugged in? Naima, do you have your microphone plugged in or no? can everybody else hear me? Rubina and Irum, can you hear me?
Yeah.
Okay.
Yeah.
So let's just continue, and then maybe I think Sahil in the background is going to try to figure out why we can't hear Naima. So Irum, you mentioned you know, sort of the impact on you talked a little bit about mental health, and I think, you know, the pandemic is going to have just really unforeseen implications for you know, global communities. You know, the impact on mental health is going to be huge. I think this is something that, you know, we will really have to sort of make provisions for in the future.
I think absolutely you're right. And now from going from a kind of something cheerful to something not so cheerful, the provisions weren't great to begin with before this crisis. So, for example, I've just finished a piece of work which I can't really talk too much about. We were going to launch it just last month, and we've had to push it back for the crisis. But what I'll tell you a little bit is that we looked at mental health in Muslim youth, and we saw two really important things, that they were kind of under this double bind of community stigma and stigma from health professionals and the wider community. So, for example, there is a kind of a distrust of, or kind of a lack of understanding is a condescending word, but just a lack of conceptualization of mental health in ways that maybe other communities or other individuals might understand it. Amongst South Asian Muslim communities, there's a lot of stigma about having mental health issues or needing to talk to someone, and a crisis like this will exacerbate those mental health issues. But on the supply side, the resources won't really be there. So even if individuals break outside, you know, social conditioning and talk and reach out to someone and say, hey, I'm really struggling, I'm really suffering, I need to talk to someone about it, will the resources be there, whether they be at the level of community level mental health outreach or the NHS? The NHS, as we know, is completely overburdened. There are huge waiting times if you're referred by your GP or you self-refer. And the barriers to entry are really incredibly difficult. They're incredibly difficult even if you persevere. And in cases, in communities and in kind of groups where, you know, you might not be taught to value mental health, or you might just not even have the luxury of thinking about it. You know, like, we talk about mental health a lot now, and it's really in vogue, as it should be. It's a really important thing to think about. But I think we have to understand that being able to really deeply inquire about mental health is the luxury of time that maybe a lot of people might not have, especially in these crisis conditions, especially in conditions where, you know, large families are stuck indoors all the time. This is something kind of Rubina has been talking about women being stuck at home, being maybe stuck at home in kind of abusive situations, in really pressurized situations, in situations where they're with, you know, loads of members of their families without any escape. And of course, that's going to have an impact on mental health. I'll give you a quick anecdote. I was out walking by the river in East London, and I saw two young Muslim, you know, a young man and a young woman, and they were chatting. They were sitting next to each other by the river, and they were chatting. And as I walked past with the stroller, I heard them say, well, because of COVID, we won't be able to see each other because I can't get out of the house. The only time we used to be able to see each other was when we would go to work. And we don't know if that's going to happen. And, you know, you're my friend, and and I'm not allowed to speak to you. And I say that not to stigmatize communities in any way, but it's just a small glimpse of how, because we're stuck in the house, support structures that might have existed before, you know, don't exist now. And what replaces those support structures, we don't know, because those support structures weren't great even to begin with, and mental health access wasn't great, you know, across the board, even before this crisis hit.
Absolutely. Thank you, Irum. Naima, I think, can we hear you now?
Let's try.
Oh, wonderful.
Yay.
Thank you so much for persevering. So Naima, would you like to jump in?
Yeah, apologies first of all, because of all this faffing around I've just done. Irum and Rubina, I've probably missed so much of what you said. I took the notes from the beginning of what you mentioned in response to the title, but apologies if I'm going over ground that you've already covered. So Samia, your first question was about our response to the title of this talk, COVID-19 and Beyond, Visions for Tomorrow. And I think it's really great that we're doing visioning work, but when I read this title, I thought now is the time to be building that tomorrow and doing that work to see the kind of future that we want, and therefore asking those questions. And I think from the perspective of inclusive mosque and myself as well, I think there are a couple of things that are at the forefront of our minds on this. One is something that Sheikh Michael Mamisa, who's a scholar at Cambridge, mentioned to us at an event a few years ago as part of our Raise Your Gaze series. He talked about remembering that in any era, there have always been voices of protest against injustice. And now is a good time to take a little bit of stock about what has led up to this, and therefore the injustices we need to fight in order to mitigate the chances of that happening again in the future, or mitigating the damage that has been done by that build-up. And so a lot of what I'm talking about, and I'm sure Irum will have covered as well, is the decimation of the NHS, the decimation of our healthcare systems, and the ill treatment of our healthcare workers. And there have been, to reiterate the point, many voices of protest for many, many years. Really time to seek those out now more than ever before. And that means really pulling in from the margins, the voices that are often pushed out, erased, ignored, suppressed, seeking those out proactively. And those will be the people that we don't see on the news, that we don't hear on the radio, that we don't see in these panels as well. So people, for example, who experience multiple forms of oppression. Irum talked about the triple bind of BME people. I think we need to be looking for those people who experience disadvantage from multiple angles and at multiple levels always, including and especially disabled people.
Yeah.
I think we also need to be looking really, really carefully at the rights of refugees and migrants. I know Rubina touched on that a little bit in her response, but very, very much that knowledge building from the margins, I think, is really important at this stage. And then secondly, to say that if we're looking up actions of what we can do, as well as all of that reading and all of that knowledge seeking and listening to those podcasts and thinking about the talks and lectures that we can get our hands on and the first person essays that we can read and the articles and the quotes, I think Zakat is going to become really, really important very, very imminently. So being able to make a really clear, precise understanding of how we as individuals and our families are positioned when it comes time to give Zakat, I think is going to be really important.
That's great. I just a question in the comments. Perhaps I could bring Rubina in to answer this. The question is from Salima Kausar, and she would like to ask what is being done at the community level, because many in the Muslim community do not understand the COVID-19 language, so the jargon that's that surrounds the virus. Is a barrier sometimes to sort of understanding and to taking action. So what is being actively done?
I think, interestingly, in Manchester, I've seen a lot of translation. I think people, a lot of community groups realize very quickly that there is a very specialist language of the pandemic, and these things have to be explained in local languages. So I think, a lot of community organizations got a lot of initial, of course, the directives of the government have kept changing, from day to day. But the very key messages that needed to be set out initially for the community have been translated in, I don't know in how many languages, but I've seen in quite a few languages. And I think the thing that was done was that information was actually mainstreamed and put on websites so that the community starts accessing knowledge. I also think, and I think the local MPs were quite active in in their local areas to send pamphlets through the doors, giving basic information about what this pandemic is, what it actually entails. And some of it, especially in ethnic minority areas in Manchester, we have seen that some of these translated pamphlets have come in through the door, which again has become which is again a very important means of educating the community. So, and I think, the messages were sent very clearly that, stay home, stay safe. I live in a very, predominantly ethnic minority area, and I'm surrounded by mosques, and none of the mosques are working and, are offering prayers. And again, like Irum was saying, there is been a very strong message that is coming through, where local authorities are working in conjunction with community leaders to say, say that this is an important message that needs to come through, and people need to, these are the things that people need to do. So I think, and I think, transcending the language barrier has been one of the biggest achievements very earlier on, that, that a lot of community organizations, a lot of grassroots organizations, it didn't come from the government in the first place, took it up as an initiative and did it because they realized that that was a real need.
Can I just also jump in? Sorry, could I just jump into Rubina's point and talk about one of the things that's come out of this crisis locally has been community level WhatsApps all through the country.
Yeah.
And so we do in Tower Hamlets, there's a borough-wide WhatsApp, COVID-19 WhatsApp and Facebook group. Then there are localized ones that go as small down to the street. And these groups have been great resources for helping those who are vulnerable, those who are self-isolating, those who cannot get out to get resources or shopping or medical help, prescriptions, etc. And this has been a real success. So this is, again, an example of people not waiting for government intervention, people getting together at the grassroots, chatting to their neighbors, chatting to people 2 streets down and saying, how can we respond to this? Now, the danger of the success of this is, and I'm going to be political here, is a Tory government, going back to the big society agenda and saying, hey, look, there doesn't need to be government level intervention. People are doing it for themselves. See, the community organizers and things take care of themselves. But what I want to point out is this has had to happen because of austerity, because the community level resources have been decimated, that people feel compelled. It's a life and death situation. It's not people getting together to chat and have a cup of tea. It's, people self-isolating, not being able to get basic food and services, and their neighbors coming to their aid. So I really wanted to point out that kind of limber and responsive community engagement has really been happening during this crisis, and has really shown us what people can do when they self-organize.
But also, I think that there's a larger point that needs to be made, that charity, is not, and, people's,
Absolutely.
good-heartedness is not a solution for the government not taking responsibility.
Absolutely.
So I think it's really important. The question of state accountability is really, really important at this particular point of time. And I think that's something that really needs to be talked about very openly.
I mean, and again, there's this issue of that, speaking of BME communities. So the government has announced kind of vaguely this inquiry into BME, why so many BME people are dying from COVID-19, both within hospital staff and in the community. And they have flagged up potentially Trevor Phillips as someone who would be leading that conversation, leading that inquiry, or a strong part of that inquiry, and to kind of put someone who has a huge track record of Islamophobia and racism against Muslim communities at the top of an inquiry isn't the way you get community on board, isn't the way you show the communities, multiple plural, that you're serious about really digging into the reasons behind anything. And as Rubina just said, I think the success of community organizing during this crisis will be actually used against communities as a way of not taking accountability and using kind of this wartime blitz spirit language of, we're all in this together, and if we pull together, anything is possible. And we really have to be aware, again, that as Naima flagged, that this is not hiding, that people have been pushed to the margins, people have been speaking out against these injustices for a long time and have been ignored. And now under crisis conditions, people are rising as they always do, but that doesn't mean that these old deprivations, these old inequalities, these old deep-seated structural problems, aren't gonna not only still exist in this quote new world, but are actually gonna be worse in this new world because of the socio-economic consequences of COVID-19.
So, Rubina, if I could ask you to just also jump in on this issue of sort of how do we, hold those who are in positions of power to account when we are having to socially distance, we're quite atomized and we're unable to mass together. So, how do we actually, protest and organize? What will activism look like when we are sort of kind of fragmented? I could ask Rubina to comment first, and then Irum, if you could also comment too.
Yeah, I think it's a very important question, Samia, because I think we are constantly talking about, like what is happening what is going to be the future in the world of social distancing. I don't really like the word social distancing. I think, we need far more social camaraderie than we've ever witnessed. And I think, as much as we need the social camaraderie, and as much as we, I like to use the concept of radical compassion. But I feel, even despite having being radically compassionate to each other, and in coming together in the ways that I think we cannot let the state, we have to ask very critical questions to the government, right? And I think, I think, your question of how are we going to resist, how are we going to unionize, how are we, and I think, and how are we going to come together, because, like I said in my talk, like, I think it becomes really important. We need unions, we need the feminist movement, we need the civil society, to come together in more ways than one. But I think, we have to come together with the aim of holding the governments accountable. Why is it that, during current times, uh, governments that are led by women, for instance, Angela Merkel's government, or for instance, the Prime Minister of New Zealand, why is it that they manage to have the kind of support that they have in current times? People trust them. Yeah. And there is something that, we have to do about questioning our political choices as well. And I think there is something that we really, because in the post-COVID world, and I think leadership, in during current times, I think what is becoming, again, the economic logic, the capitalist logic is not serving, is not serving the survival of people, is not serving the well-being of people, is something that is coming across time and again. And I think it's really important to think about, what happens, how do we think of a world which is where there is the idea of political accountability, where we bring people, where we hold politicians to account. How is it that we want to, how is it that we want to, do we kind of collate like a complaint book? Like, I don't know what we do, but how do we present like a different kind of evidence, to the commissions that are being set up, which is where, again, I feel the role of social scientists, the role of, yes, and I think the idea of social distancing, and how do we operate, and I think the virtual medium is an amazing medium. And I think we do need to continue to organize and come together and think of ways in which some of these, some of the gains from the women's movement, from the trade union movement, like all these different movements which have strong histories, right, continue to hold governments accountable, hold management accountable, to hold governments accountable. Also, civil society organizations, coming together, making claims, especially from a BME perspective, how do we hold governments accountable to carry some of these, concerns, further.
And I think something that Naima was, unfortunately, she's lost her connection. So, but something that she was talking about was the way in which the marginalized communities, those on the fringes, how do we bring those, how do we enable them to access resources? And, that, I think that's a huge part of the post-COVID sort of effort, looking at what came before. But Irum, if you could also elaborate on this idea of what does a post COVID-19 activism, what form will it take?
I'm going to make, I think, three points, and they're related to Rubina's, or kind of building on that. Firstly, the issue of political choices and how do we present evidence almost to the greater public about political choices. I don't know if anyone saw PMQ today, and it was Boris Johnson facing Keir Starmer in an empty House of Commons, facing each other with very socially distanced MPs. And what we saw were two leaders talking to each other without the backbenchers yelling and clapping and stamping. And what we could see very clearly was the conversation. And I think sometimes in political theatre, all of that gets lost. And perhaps in this world of social distancing, where we're not, this kind of crowd and mob mentality, it's just not, we're just not able to do it for purely health reasons and physical reasons. Maybe that might be a way of showing much more clearly to people what leaders are saying when they don't have a baying crowd behind them, kind of supporting them. I don't know. That's kind of, amusing. Secondly, I think I want to talk more about what COVID-19 has shown us is that a new world of work and access was always possible. People just didn't want to do it. Businesses didn't want to do it. Governments didn't want to do it. It didn't, it wasn't financially advantageous for them to do it. And suddenly, overnight, flexible working, which working mothers have been asking for decades, working parents, I shouldn't say working mothers, because it penalizes all sorts of, both sets of parents have been asking for decades, suddenly became available. Jobs that weren't able to be done remotely. So a lot of disabled people or differently able people weren't able to access those jobs are now being able to be done from the comfort of your own home. Presto, hey. So when the need arose, capitalism rose to the challenge, and overnight our entire world of work changed, and we can't let it change back. So I think when employers want to go back to the old normal, which, let's not mythologize, the old normal was terrible for many minorities, many people in the margins, many people who weren't able to participate in the old world. We have to, hold up what this world looked like and say, no, it's possible to work from home. It's possible to increase access to educational resources, to put things online, to give access to free Wi-Fi for deprived communities. And so we have the evidence. It's happening now. So I think that's been a great thing, that we can say that the world's changed. We all saw the world change. We saw the new world become possible. So that's one thing. Secondly, when we talk about government accountability, I think what we have to, make really specific moves. For example, trade unions will have specific demands and advocate for their groups of people, but really simple things at the level of local government. For example, during this crisis, local government funds have been allotted on a per capita basis, not on a deprivation basis. So to me, this is really, it just makes no sense to allot resources to wealthy local councils on the same basis as you're allotting resources to deprived local councils. Obviously, there will be greater need in poorer boroughs. So, for example, taking those things into account. And I know we're probably running out of time. So the last thing I'm going to say is we have to keep fighting against austerity. I mean, at this point, no one wants to hear the word austerity. No one wants to hear the word Brexit. But these things will not go away. And COVID-19 will exacerbate all the negative effects on marginalized and poorer communities, will exacerbate gender disparities. So the fights that we were fighting before this happened against austerity, to increase community funding, to increase accountability, to increase funding for the NHS, for mental health resources, for gender violence resources, all of those things we're still going to have to keep doing. And I think the change that will happen is that we are now all tuned into this virtual medium. We're all now watching because, again, this thing happened, and overnight everyone went onto Zoom, everyone went online, everyone went to Instagram, everyone went to Facebook. So let's use this technological tool that now everyone is tuned into to hold up to light these exacerbated injustices.
Rubina, I thought the answer to a question that we've just received from Suraya Kundengar. Apologies if I've the name. And the question is, what do you think about the no return to unsafe work campaign that's gaining ground? Because,
sorry, I can't hear you. I can't hear you very well, Samia.
We've had a question with this talk about sort of getting the economy back up and running, and people talking about the easing of lockdown and potentially people having to go back to work in unsafe workplaces. What can we do to sort of challenge that push to sort of get back to work?
I think resist. I think just today at University of Manchester I didn't attend it. I had a meeting because I was in other meetings, but a colleague of mine attended a union meeting, and I think one of the things that they resolved was how they were going to, resist going back to work until and unless, conditions were totally safer. And that's the privilege, again, that's the privilege I have as a very middle class academic, but which I am aware a lot of people don't have right now, and like we've been saying, lockdown is a privilege, and not everybody has had the luxury of staying home, staying safe. But I think the most important thing is to really resist going back to work in really unsafe situations, because using unions, using the force of the collective in however way you want to you want to form the collective at this particular form of point of time, to really think of, how are you going to push back on that kind of a pressure, and what are the kind of solutions you're going to come up with in the new working world, where where safety is made quite central.
Okay. And Irum, could I ask you to make sort of a final closing point that really is a sort of a productive, constructive way in which we can end on a hopeful note?
Well, the hopeful note is that, first of all, this won't last forever. And secondly, I think it's an opportunity. It's very easy to look at this and say, and look at all we've lost. And as both Rubina and I and Naima also mentioned, is that the world that existed, and I've said it many times, wasn't an amazing one to begin with. If we look at the communities in the margin, they were bearing the brunt of government policy, of austerity, of capitalism, of poor resourcing, of government cuts, and so on. And I think the hopeful note to end on is this is a chance to remake things. And it's a chance to look really closely at what wasn't working and to think about how we can make it different, and be that the world of physical work, the world of remote working, the world of giving flexible working, making that much more accessible, of understanding that we have a lot of privilege, as Rubina just said, that those of us who are kind of middle class, where we can sit in our studies and at our table and self-isolate and complain about how bored we are. But this privilege doesn't extend to the majority of the world. Rubina mentioned, people are dying of hunger because there are countries like mine, like Bangladesh, that have imposed lockdown with no preparation. And the problem isn't dying of COVID-19. The problem is dying from hunger and starvation because you're not working. And the only way you make money in a country where there is no safety net is to work. And if you don't work, you can't feed your family. I think what COVID-19 has done has brought all these things out of kind of the background buzz of the news to the forefront. I think people are really feeling these things more. And I think that can only be a good thing. That can be a positive thing. And instead of being overwhelmed, because I think sometimes we look at our situation now and we look at all the terrible things that are going on, and we really feel overwhelmed. We feel like there is possibly nothing we can do. It's all terrible. Let's all give up. And my kind of closing comment is, do what you can. So at the very small level, support accountable journalism, subscribe online digitally to the newspapers and media sources that you trust, help them to do the work of holding politicians and power accountable. Support local businesses, go shop in the mom and pop shop at the corner instead of going to the big supermarkets. Support your local community, be part of those WhatsApps and see what you can do. You might not physically be able to go out and deliver groceries, but donate to food banks, donate to local charities, just be aware. So this is kind of the time to reset what we want and what we expect. And that can be in the smallest of ways, or it can be in the largest of ways. And all of that is available to us.
Thank you, Irum. I will just quickly ask Rubina to make one sort of very brief closing remark, and then I'll have to wrap up, I'm afraid.
I think, like Irum said, I think this is like the most opportune moment for collective reflection. I think something that we all have to think about, what is the new world that we want to walk into? I think, and something that we haven't touched on is I think it's also very important to talk about the environmental question, the climate change question. Why did we get here in the first place? And I thought I had to end on that. And I think, and this is the moment that we need to really think about, why did we get here in the first place? How did we get here in the first place? And how do we want to walk out of this situation? My final message is, yes, I think compassion is very important, but a support, build communities, support, like everything that Irum said. I just want to reiterate, and I think the future for me is intersectional. And I think that is the last note that I want to end on. I think we cannot talk about the future without talking about the crisscrossing of race, class, ethnicity, and culture, but also, the larger system. And I think accountability, I think holding states to accountable is extremely important. And I'll finish. And state leaders, like, questioning ideology is also very important. I have lots to say, but I think I'm going to finish on that note.
Unfortunately, we're actually with the hour, but thank you so much to Rubina and Irum and to Naima, who I'm really sorry her Wi-Fi connection kept dropping out. So I know that she's very sorry that she couldn't take part, but we will be, Naima will be sending us some links and resources that we can put up on the site, so you can get a sense of what she was hoping to input. But I'd like to thank all our speakers for some really positive and constructive insights. Thank you so much. Learned a lot today. Also, please, for those of you who are watching at home, do comment and send us feedback on what we've talked about today, what you think we should expand upon, what worked and what didn't work, as we do hope this event will be the beginning of an ongoing series of conversations. We will, as I said, we'll be sending out resources and follow-up material. And do also check out the Muslim Institute's social media platforms and our website for information on upcoming activities. And if you liked what you heard today, do consider becoming a fellow of the Muslim Institute to become part of our community, providing a space for critical thinking. Details on how to sign up are on the website. But that's it for now. Thank you very much. And we hope to continue these conversations in the future.
Thanks, Samia.
Thank you, Samia.